All right, welcome. Today, we're going to build the ultimate nursing toolkit for pediatric care. We're going to break down the essential developmental theories that will totally change how you understand and care for your youngest patients, from the tiniest infants all the way to adolescents. Let's dive in.
So why does this happen? Well, the answer really comes down to their developmental stage. See, a 4-year-old is not just a little adult, and a 14-year-old isn't just a big kid. Each age group is running on a totally unique mental and social operating system. And you know what? Understanding that system is the key to effective and really compassionate nursing care. That belief about the IV pump being alive, that's not just a cute fantasy. It's a very specific cognitive rule they're living by.
So, our first tool in the toolkit comes from Arnold Gesell. His theory is kind of like the foundational blueprint for a child's physical growth. It helps us see the predictable sequence of how they mature, which is absolutely crucial for spotting any developmental delays early on.
Okay, this is a really important distinction to make right up front. Think of it like this. Growth is the hardware. It's the physical stuff you can measure, like height and weight. Development, on the other hand, is the software. It's all the functional skills, like thinking and moving, that run on that hardware. They're definitely linked, but for your exams and for your clinical practice, you have to know they're two different things.
Now, this growth isn't random at all. It follows two really predictable patterns. First up is cephalocaudal, which is just a fancy way of saying head to tail. To remember it, just think C for cap on your head. Control starts at the head and works its way down. Second is proximodistal, or center to outward. Think proximity. Growth starts close to the core and moves out. This is exactly why a baby can wave their arms around way before they can master that tiny little pincer grasp with their fingers.
Okay, so beyond just the physical stuff, we've got to think about temperament. Are they pretty easygoing? Do they need a little extra time to adjust, maybe even complain of a tummy ache when they're in a new place? Or are they highly distractible and irritable? Figuring this out early helps you tailor your approach and honestly can help you avoid a total meltdown.
All right, time to put this into practice. Here's our first checkoff question. You walk into the room and see this exact scenario. The key clues are new place, clings, and tummy hurts. Based on temperament theory, what's your next move?
So the correct approach here is B. This is a classic slow-to-warm-up child. That tummy ache is a super common sign of anxiety in new situations. It's not manipulation. Your number one priority is to build trust. And how do you do that? You give him time to adjust from his safe base, which is mom's lap. If you try to force the interaction, you're only going to ramp up his fear and make your job way harder.
Okay, tool number 2. This one's from Erik Erikson, and it's all about a child's psychosocial job. The idea is that at every single age, a child is working through a central social crisis. Our job as nurses is to figure out what that mission is and do everything we can to help them succeed.
This chart right here is gold. Just look. For an infant, the job is developing trust, so our intervention is all about consistency. For a toddler, it's autonomy, so what do? We give them simple choices. This is huge because, as we'll see with Piaget, they think in very concrete, almost magical terms. A choice between two cups feels like real, actual control to them. For a school-ager, it's industry, so we let them help. And for an adolescent, it's all about identity, so we have to respect their connection to their peer group.
Okay, let's apply this. We've got a bored 9-year-old who wants to help. Nurse A tells him to just rest, but Nurse B gives him a task. Which nurse is using Erikson's theory correctly, and what's the name of the stage they're in? Yep, the right choice is B. A 9-year-old is squarely in the industry versus inferiority stage. At this age, their self-worth is so deeply tied to feeling competent and productive. By giving him a job, Nurse B is validating his need to contribute and building up that sense of industry. Nurse A, even with the best intentions, risks making him feel useless and inadequate, which is the very definition of inferiority.
All right, on to tool number 3, and this one is a big one. It's from Jean Piaget. If Erikson gave us their social mission, Piaget gives us their cognitive operating system. This is all about how a child thinks. Remember that 4-year-old and the IV pump? This is where we find the answer. You just can't use abstract logic with a child who literally thinks in magic. Piaget helps us match our communication style to their mental software.
This timeline really gives you the roadmap. You can see how they progress, from sensoria motor, where they learn by touching and doing, to pre-operational, which is the age of magic. Then comes concrete operations, where they need cold, hard facts. And finally, formal operations, where they can start to think abstractly. Each period has its own set of rules for how they process the world.
Now,
I really want to zoom in on this pre-operational period from about ages 2 to 7, because this is where things get, well, magical. These kids are egocentric. It's truly all about them. They use something called animism, which means they think that an IV pump or a teddy bear is alive and has feelings. And they use magical thinking, often believing their own bad thoughts are what made them sick. This is why a simple blood pressure cuff can feel like it's biting them.
So with that in mind, let's look at this situation. You have a terrified 4-year-old who's about to get an X-ray. Why is demonstrating on her teddy bear the #1 priority intervention? What specific cognitive concept are you tapping into?
The logic here points straight to B. At 4 years old, she is deep in the preoperational period. Because of animism, she sees that teddy bear as a living, feeling being. By showing her that the camera won't hurt her bear, you're speaking her natural language, the language of play, to communicate safety. This simple act respects her cognitive stage, and it directly supports Erikson's goal of building trust.
And that brings us to our fourth and final tool, Kohlberg's theory of moral development. This one helps us understand the why behind a patient's choices. Do they follow the rules to avoid getting in trouble, to get praise, or because of some deeply held ethical belief? Knowing this helps you motivate them in a way that actually works.
So, Kohlberg basically gives us 3 levels of moral reasoning. Young kids are pre-conventional, making decisions based on what's in it for me, avoiding punishment or getting a reward. Then, school-age kids and teens are conventional, which is all about social approval and following the rules. And finally, some adults might reach the post-conventional level, where they're guided by a personal code of ethics and universal principles.
Okay, last one. Let's lock this in. A 10-year-old absolutely refuses to take his bitter medicine. The nurse offers him praise and a gold star. Which moral stage is this nurse targeting? Think about what really motivates a kid at this age.
The most effective approach is C, the good boy, nice girl stage. At 10 years old, this child is firmly in the conventional level of reasoning. His main driver is social approval. He wants to please the nurse, please his parents. This also ties right back to Erikson's industry stage. Being the good boy who takes his medicine makes him feel competent and successful. Praise and rewards are the perfect intervention here.
So let's take a step back. We've just built our complete 4-part toolkit. We've got Giselle's physical blueprint, Erikson's social mission, Piaget's mental software, and Kohlberg's moral compass. Now let's put it all together. This chart right here, this is your master key. This is where it all clicks. Look at the toddler row. Erikson's task is autonomy. Piaget tells us they think magically. So what's the intervention? Offers simple, concrete choices. It satisfies their need for control in a way their brain can actually process. Now look at the school-ager. Erikson's task is industry. Piaget says they think in concrete, logical terms. So the intervention? Let them help with their care and explain things with simple diagrams. This gives them that feeling of competence they desperately crave. You see the pattern? The social need from Erikson plus the cognitive style from Piaget gives you the perfect nursing intervention every single time. Take a second to really let this sink in.
And remember, this isn't just theory for an exam. These are practical, real-world tools for your daily practice. So the real question is, the next time you walk into a pediatric patient's room, which tool will you reach for first? How will you see that child not just as a diagnosis, but as a person who's actively working through a vital stage of their development? Thanks for joining me.